So it is important, and it behooves us to recontextualize our discourse historically, because it has implications for our work with Latino peoples, the first, second, and third generation in this country, as will be addressed later. It is my challenge then to attempt to weave a synthesis that captures this text. In fact, a review of the program titles provides, and the conference program titles, provides a glimpse of current concerns which appear to embody an emerging clinical focus, an emerging discourse towards a liberating, socially committed psychosocial practice. There is a focus on examining reflectively our work, on questioning it, on assessing our roles, on empowering our communities, on exchanging valuable experiences and looking at ourselves. It is a very rich program, one that impels me to stand back and frame it within a discourse of emancipatory actions. But let's go back in time first. Let's do a little bit of time travel. Let's see what happened before. Let's historize our process, at least of this area during the 70s and 80s. Not only for those involved to remember, but to incorporate others into that collective memory. Now, I may leave out some issues and some programs, but please remember that this is a sketch to contextualize our main points. It seems that during the 70s and 80s, mental health concerns, as articulated at that time, and it may have been so in other parts of the country too, but as experienced here, as articulated here, witnessed an emergency militancy about what issues were relevant for Latinos, and an incipient questioning as to the relevance of a host of ideas and practices for the prevailing mental health discourse. This too was paralleled, I think, by the questioning occurring in the Black community and in Indian communities about practices and ideas, right? For example, there was justified concerns reclaiming that cultural aspects be attended to. Do you remember when those arguments, that was the 70s, that was the 80s, we don't have to argue that anymore, but that had its time, that had its history, okay? So those were some of the concerns, reclaiming the importance of culture as important to attend to. That it was important that we needed to contextualize people's experience in history. That we needed to help use things as refranes, songs, folk stories. You know, that's older news. I don't want to say old news, but the use of cultural aspects woven into therapy started to be discussed in the 70s and the 80s and became legitimized. But that was part of a struggle that had to take on, that people who were here took on, argued for, okay? There were concerns related to the impact of assimilation, acculturation, and biculturality. I remember all the polemics about, you know, who is more healthier, if you're assimilated, non-assimilated, bicultural, non-cultural, blah, 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 okay? Those were issues that maybe still, but we need to pull from that back what we learned, what was argued at that time, okay? There were emerged vivid discussions, I mean, they get vivid, right? On Latinas women and their oppression and their changing roles and what that meant in this country, with other family members whose changing roles were maybe not changing as fast as Latina women. There were issues about bicultural adolescents speaking English and their parents speaking Spanish, and then how do you do family therapy? You know, what do you do? Okay? There was issues about validating multidisciplinary and collaborative community efforts. At that time, that was still new. You know, getting people together to do things. Old historical situation, but sometimes that's not easy, okay? There was issues about supporting peer projects, lots of peer projects, of advocating for paraprofessionals. That was the 70s and the 80s, all right? There was issues on examining the ideology of machismo to really understand what is machismo, you know, how it does get perpetuated, how the system perpetuated, its positive and aggressive aspects, and its impact on Latino males. There was issues on validating sociocultural approaches to interventions. There was even issues on how maybe we Latino therapists colluded in therapy. That was very important, that was critical, okay, and that can happen. There was questioning about ethnic scotoma, I don't know if people remember some of that. There was concerns of not pathologizing social injustices. on being judicious in diagnosing, on examining the appropriateness of testing of Latino children. There was concern on observing intra-family racism. Do people here remember issues on, well, you have maybe a Mexican family and one looks more Indian, the other one looks more Spanish, who is the preferred? Or if you have a Puerto Rican family and you have a series of colors, because in our families we do have a lot of colors, you know, what happens to the darkest one? Okay? That kind of debate, that kind of experience was discussed in meetings, in case conferences, etc. There was lots of concerns about what was happening in our communities in terms of drug and alcohol and violence. And now we know what's happened. AIDS has happened. Okay? We should have expected it. Particularly the Puerto Rican community has been for years, since the 50s, absolutely ravaged by drugs. We have not been able to stop it. And we still can't answer the question, why? Why have we not been able to stop the flow of drugs and the self-destructiveness in the Puerto Rican community? So there was a lot of questioning, and there was a lot of ongoing debates about, I remember, the relevance of psychoanalysis. Okay? Remember those debates? And some of that, unfortunately, helped people become disenchanted with certain forms of psychoanalysis. And there was issues on how we best had to work with poor people. What were the interventions that worked best? There were very few issues regarding looking at the therapist. Okay? What changes does the therapist have to make to carry on what has to be done? So most of this occurred in workshops and conferences, and it was a very rich period. It was also a period where everybody wanted consultation. Community consultation. You'd solve a problem, you send a consultant over there to Roxbury, and you send a consultant over there to Lowell, and Shani's laughing over here, and you send, because that way we could clarify what cultural sensitivity is about, and what blacks are about, and how Hispanics work, and lots of crazy things happened. Some of it, we got too culturalistic, and so there was a laundry list of, what culture was. I mean, that's very frightening because, hey, if you're not in that mold, you're in trouble, okay? So it was a period of developing ideas, ways, okay? So that period, I think, was fine. It was a very rich period. I feel very happy that I was part of it, and I wanted to have this history because I wanted to include those who weren't part of it in that process, because I think that process happened in this country. Armando could probably respond to that. I think it happened in part in the Chicano community over in East LA and Texas, and I think it happened in part also in the black community.